Hi folks, welcome to my channel, The Average Dermadoc. Let's begin the show. Rifampicin, also known as Rifampin. It is a synthetic derivative of Rifampicin. Available in capsules, syrup and IV formulations. Have to be taken on an empty stomach. Why? Because food and antacids reduces its absorption. So 1 hour before food and antacids, 2 hours later food and antacids. Highly lipophilic, so it crosses blood-brain barrier. It also crosses placenta and found in breast milk. Reaches peak in 2 to 4 hours with the same T-half. Bioavailability of 70%, almost 80%. Plasma protein bound, metabolized in liver and excreted via liver only, through bile and ultimately through feces. As it is a potent enzyme inducer, it can induce its own metabolism and reduces its T-half on long-term usage. Same like clofazimine, it is available in capsules and changes the color of all the body secretions, urine and feces. As it is excreted very low quantities in urine, it is safe in mild renal disease patients. Coming to its mechanism of action, it binds to beta subunit of bacterial DNA-dependent RNA polymerase, thus directly inhibiting mRNA synthesis. So, no mRNA, no proteins, and the bacteria will die. Bactericidal action. What is the mechanism of resistance? Because of missense mutations in RPOB gene, which codes for beta subunit of the same enzyme which rifampicin binds. So, there develops resistance. Rifampicin, if given as monotherapy, there are more chances of developing resistance. So, it is given in high dosages in multi-drug therapy as one of the combination drug. FDA approved uses are TB and meningococcal carriers only, not for active meningococcal disease. And prophylaxis. Only in prophylaxis, we are using rifampicin as a monotherapy for meningococcal, H. influenzae and leprosy prophylaxis. Bartonella, rhinoscleroma, gonorrhea, brucellosis, chlamydia, cholestatic pruritus, tularemia and methicillin-sensitive staph aureus. In all these conditions, rifampicin is used in off-label uses. T and M is for tularemia and methicillin-sensitive staph aureus. In FDA, T and M is for tuberculosis and meningococcal carriers, nasal meningococcal carriage. Coming to adverse effects, nausea, vomiting, diarrhea, ataxia, headache, drowsiness, dizziness. Main adverse effect you have to remember is hepatotoxicity, toxic hepatitis, elevation of LFTs and bilirubin. Because it is an enzyme inducer, it reduces hormones like adrenaline and thyroid hormones. So have to be cautious while treating rifampicin with hypothyroid and diabetic patients. Altered vitamin D metabolism leads to reduced vitamin D, calcium and phosphorus. In response to this, there will be secondary hyperparathyroidism to elevate vitamin D and calcium levels. Porphyria exacerbation, mainly acute intermittent porphyria, by inducing the enzyme delta aminolevulinic acid synthetase. Immunological effects. Mainly rifampin dependent antibodies will be formed, which leads to flu-like syndrome. Main adverse effect, hepatotoxicity and flu-like syndrome. Thrombocytopenia, hemolytic anemia, acute renal failure may also occur. In pregnants, there is chances of postpartum hemorrhage and hemorrhagic disease of newborn due to reduction in vitamin K dependent clotting factors. So, we have to treat with vitamin K supplementation and injection immediately after birth to the baby and for pregnant women in third trimester. Monitor CBC, platelets, LFTs, RFTs, mainly LFT. It reduces serum levels of many drugs by inducing their metabolism like anti-epileptics, arrhythmics, anticoagulants, azoles, benzodiazepines, bronchodilators, calcineurin inhibitors, corticosteroids, calcium channel blockers, oral hypoglycemics, OCPs, HMG-CoA reductase inhibitors. Out of this, the most important one is OCPs. The only antibiotic which leads to OCP failure is rifampin. Remember the channel name. Don't forget to like, share and subscribe. Thank you. Hasta la vista. До свидания.